Hello, this is Matthew Katz, pre-recording a presentation for April 25th on decision support in head and neck cancer. This will be in a few parts because this only records in 5-minute sections, but I'll be giving you all the links to all of these. Just as a way of disclosure, I have no financial or intellectual disclosures, but am a member of Radiation Oncology Associates and Chair of Communications for ASTRO. I want to go over just what we're going to go through today. Decision support, its definition and goals, its role in cancer care specifically. I will look at some decision support tools, both in breast cancer and prostate cancer briefly, but then really focus on opportunities in head and neck cancer, both the need for it, the absence of any existing tools at this point, and a proposal for continuing to consider developing its own, primarily focusing on clinician-focused, but there may be a role for looking at other options as well. So in terms of going through decision support, the definition is a computer-based information resource that provides users with support for making decisions. It can help either standardize approaches to diagnosis, workup, and/or treatment, and can individualize the process to the needs of different users, whether that's a physician or a patient. The goals really are to improve physician or patient knowledge, to individualize information, to reduce clinicians' deficit sometimes in knowledge that they can keep internally in their head, as well as to help address sometimes if you're developing this for decision-making, patient distress and decisional regret about the decisions that they might make. In the case of developing these tools, it does really provide often a better way to individualize care than you can just by simply looking at results of a randomized trial if you can have specific data for that patient. It also avoids recall or experiential bias on the part of the clinician. In general, it also appears it may be better than we are in terms of estimating how far a disease may have progressed, how effective a treatment might be, or this has not been done as well, but in some areas it's been looked at the toxicity for treatment as well. Now, what are the potential benefits of doing this, other than looking at getting more accurate information? First, it does improve often efficiency in terms of obtaining that information, accuracy aside. It can also promote better learning and training for users, whether, again, that's patients or clinicians. It can standardize a treatment approach as well if you want different people to be practicing in the same manner, and can also illuminate new approaches to treatment as well. What makes for a good support tool? Well, really, you want to have a robust database behind it, or a data resource that you think is reliable, a clear model for both context and the user criteria, who's going to use this and in what context are they going to be making any kinds of decisions. Then you want to make sure that it's easy to use, so a good user interface is very helpful. And then obviously you want to have people that are actively using this so that it's an effective tool in clinical practice. Now, there are ways to individualize decision support. Some have existing evidence-based risk estimates that are already available. Often it's helpful to provide cancer patients something that's a little bit more than standard to make sure that they get individualized estimates for their own benefit, to give a better risk-benefit analysis of any treatment decisions that they make. And it may also improve the quality of the information they get, and you can ultimately, if you do this digitally, alter it based on age, ethnicity, and individualize it further beyond the information in a generic way, if you wish. In breast cancer, this has already been done effectively for chemotherapy and hormone therapy decisions with the use of adjuvant online. This is a population-based validated tool, and it has its own particular kind of display that you can see in the graphical display there. There are different ways to do this, but this is something that also has now been done as well for breast tumor recurrence that's been developed through Tufts Medical Center and is also available and has been validated. This is the way it displays results within radiation oncology for the efficacy of treatment. This has been done for prostate cancer with Memorial Sloan Kettering nomograms. This is a very well-documented evidence-based tool, and it's been thoroughly developed both for prostate cancer and now increasingly for other areas as well.